So NeuroJourney is a new educational tool that was developed by Courageous Parents Network, actually a collaborative effort between Courageous Parents Network, Cincinnati Children's Hospital, and Dr. Julie Hauer. I'm going to give you a little bit of a brief history about, maybe I should back up and introduce myself first. Sorry about that, people. My name is Jennifer Seidman, and I'm officially the Director of Community Engagement for Courageous Parents Network. I also was a primary author of NeuroJourney. And I'm here today with my coworker, Chrissy Sally. I'll let her introduce herself.
Hi, I'm Chrissy Sally. I'm the Director of Clinician Engagement and Outreach for Courageous Parents Network. And in my role, one of the things that I do is liaise to clinicians of all types and all kinds in all places, which means introducing them to our tools, including NeuroJourney.
Thanks, Chrissy. So I myself am also the mother of a child with an SNI, severe neurological impairment, and we'll talk more about what that encompasses in a little while. But I thought I'd begin today by just telling you a little bit about how NeuroJourney came to be. Back in 2021, Courageous Parents Network did some research. And what that research revealed was that families caring for medically complex children were in a cycle that we have now named orienting, navigating, and moving forward, and that this cycle continuously repeated for families as they experienced things like new medical complications, changes in baseline, changes in their lifestyle. And it led Blythe Lord, the founder of CPN, and I to start thinking about what inflection points kicked off that need to reorient again and start the cycle over again for families. Just about that same time, a pediatric palliative care doctor at the University of Cincinnati reached out to us to share a map that was being developed for Duchenne muscular dystrophy, which charted some of the major complications, both medically and psychosocially, for families whose children had DMD. And she said to us, our hospital is really in need of a tool that would do the same thing for children with neurological impairments. And so that kicked us off into thinking about what CPN might be able to do to help marry these two things together, the medical complications that would come for a child with an SNI alongside the psychosocial and emotional ones. And of course, in that conversation, we reached out to Dr. Julie Hauer because, as you know, she is premier doctor in the field. And all of this started a collaboration between something called the Live Well Collaborative, which works on a lot of medical platforms, Cincinnati Children's Hospital, and CPN, and we set about trying to develop a tool. It was approximately a 3-year process. I like to call it the baby that I had a really hard time giving birth to because we anticipated the project taking a year. But it went through a very rigorous system, and I think it's important to tell you all so that you can have confidence in the tool and what is here in front of you. So initially, with Live Well and the Cincinnati Children's Hospital, we put together a panel of parents and providers to beta test much of what you see here today on our homepage and some of the language, including something we'll talk about in a little while, which is the arc of a life and the 4 phases that the tool is based on. After that time, we set about writing the content, and this was largely done with Dr. Julie Hauer as the lead author, and then me as the parent, supplementing some of what she medically was providing with some of the psychosocial experiences that I had. Additionally, the initial writing was reviewed by Dr. Pat O'Malley, also a pediatric palliative care doctor, and 2 other parents. After that, and we had our initial content, all of the medical chapters were reviewed by specialists within either the field itself or the topic itself, like gastroenterologist or an endocrinologist. And then we began another editing process based on their feedback. And then earlier in the spring of 2023, We beta tested the entire tool. That beta testing was done by physicians, patient group representatives, mostly family coordinators, and of course, parents of children with an SNI. Again, then it resulted in a whole nother layer or level of edits and reconfiguration. And we're proud to say the tool before you is here after that rigorous process. So again, I just want to reiterate that everything on this tool has been reviewed many times by many professionals. And parents, of course, who bring that professional lens to the table. So we thought we'd start by just showing you a little video that we've developed to help explain what NeuroJourney is, because it's honestly, it says it better than we ever could.
This video is available on the main page of NeuroJourney, so it can be it's always present and can be used to educate families as they are introduced to NeuroJourney as well. And we'll start it now.
Welcome to NeuroJourney. This educational resource and reference tool is designed for families and clinicians navigating the needs of a child who has a severe neurological impairment, sometimes called SNI. SNI is a phrase used in the medical community to describe a group of conditions or disorders that affect the brain and central nervous system. Signals from the brain control all of the systems in the body. They tell our lungs to breathe, our bowels to move, and our hearts to beat. Signals from the brain to the spinal cord drive our movement. So when the brain is impaired, all bodily systems are affected. There can be physical discomfort, problems with movement and thinking skills, and other medical complications as the condition progresses. Categories of SNI include metabolic neurodegenerative disorders, genetic conditions and syndromes, developmental epileptic encephalopathy and seizure disorders, and brain malformations, infections, and injuries. Every child is different, and the issues that may arise during an SNI journey may be different. Challenges might appear over an expected time frame or one that's unpredictable. For example, some children with SNI are never able to walk, while others walk and then lose that ability over time. Some can feed themselves for a period, and some will always require support. Most experience pain, and some become frustrated and irritable. Some are verbal, and others communicate in unique nonverbal ways. This tool is designed to help you understand what may be happening to your child and to anticipate things that may arise now and in the future. It presents the medical topics you're likely to encounter, and you'll also find perspectives on the emotional and social topics that are part of providing loving care for your child. NeuroJourney uses 4 phases of full life to help you understand the challenges you might face, anticipate the conversations you may have, and prepare for the decisions you may need to make as you determine your goals of care for your child and navigate the illness journey. The phases are adapting to diagnosis, as your family adjusts in the early months following diagnosis or the emergence of issues. Building strengths to maximize your child's core skills and your family's resiliency for the journey ahead. Adjusting to changes, which involves making decisions and adapting to your child's evolving baseline throughout their journey. Navigating decline, as your child outgrows their brain's ability to manage their bodily systems. Your family may need to adjust their goals in preparation for the end of the journey. The content marked with a heart offers thoughts and perspective from parents and clinicians based on the concepts of palliative care, which focuses on quality of life and includes relief from symptoms and physical and emotional stress. You can see the map all at once, or follow the phases as they occur in your child and family. Some prefer to plan, and the others like to take things as they come. Some topics, especially the medical ones, are more complex and have layers of detail. You can take all of the time you need, exploring each topic as deeply as you like. There is no right or wrong in caring for your child, only what works for your family. The important thing to remember is every child living with an SNI has the potential for a meaningful life with a true arc. NeuroJourney.org is an initiative of Courageous Parents Network, a nonprofit organization. It was developed by a team of medical experts, parents, and content editors working closely together to make these difficult topics easier to understand and navigate. This service does not provide medical advice. It is for informational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please see the terms of service and disclaimer for more information.
So as I mentioned, that is a very quick overview of what NeuroJourney is and what it contains. But Jennifer and I are going to continue by breaking down these elements and doing a bit of a deeper dive with you today as we walk through this virtual tour of NeuroJourney. As we scroll down here on the main page, you will see, as the video described, the concept of the arc of a life. And this is a concept that the map throughout the NeuroJourney site is imposed on. It is based on the idea that all people have a beginning and an end to their life, and then there is everything that happens in between. And we have this little swirly gray line to represent the fact that this might be a non-linear experience for families, but that their child can live a full and joyous arc to their life. NeuroJourney is divided up into 4 phases, and while they might not be as clean as they are represented here by these 4 colors in terms of a start and finish, we did receive feedback along the way that some families may benefit having a sense of where they are along their child's journey. And so the map is divided up into those 4 phases.
So as Chrissy said, creating an awareness of where they were in the illness journey was something that we heard repetitively, both from the clinicians serving these families and actually the families themselves who participated in some of our beta testing. But equally what the families expressed and what, of course, we at CPN adhere to, because palliative care is so very important in all that we do, was that families and clinicians needed that sort of companion to go along the way with them as they were reading about these complicated topics, that validated and acknowledged some of what families were experiencing emotionally. And so we integrated into this tool the column that is represented here by the heart and always sort of in that peachy orange dialogue. And it really follows the reader or the experiencer through every aspect of the map and tries to, as I said, acknowledge where the family might be in that position and some of the complications that they've been going through. And we heard from families that they feel very seen by this dialogue. In fact, we've had some families tell us that their favorite part, or the parts that they've really only explored, is the companion text, because it gently introduces some of the more difficult topics to them. And then equally, we've heard from some clinicians that in reading this companion text, they've developed a greater awareness of some of the complications psychologically and emotionally that families might be experiencing. So we really feel that this is a strong point of the tool.
You'll see down as you continue along this main page, there are 4 core concepts which are described for families as a learning tool for them to take with them throughout their exploration of NeuroJourney.
And again, sorry, Chrissy. I was going to say, and again, what we've heard from parents and what we try to help parents know is that sometimes when you speak the language of clinicians, the conversation goes better. So we like to introduce terms that families need to know, like baseline, so that they feel confident in those conversations with the family. And this is, again, all of these concepts are presented with a palliative care kind of point of view and gently.
NeuroJourney is actually 2 maps. We have a medical map and a psychosocial map, and we are going to, sorry, I just lost it. I'll pull it back up here. We're going to walk you through each of those maps separately. And we will begin with the medical map. So you can go to the drop down at the top of the screen here and choose medical topics. Everything that you see is formatted the same way. So once the user has a sense of how to use and navigate NeuroJourney, they can become more nimble because it's all set up and organized the same way on the various pages. But here on the main page, the medical map, you will see those 4 phases to the arc that we mentioned earlier, going across from left to right. And then from top to bottom, we have the systems or symptoms that most of these families will need to be thinking about or making decisions for throughout their child's journey. As was mentioned in the video, for families that are possibly near the beginning and not ready to look ahead, they can filter by phase and just look at the information for the beginning as they adapt to the diagnosis. And for the purpose of today, I'll go back to the full map. And we're going to choose the gastrointestinal topic to explore at a deeper level. So the user clicks in that topic. And then all of the topic pages are formatted in this way. The upper right side of the page includes a bit of information that describes what we mean by the topic header, but also why it's an issue for children with SNI. And it also provides education for the learner, whether it be a family or another provider, on the connection between what's going on in the central nervous system and that domain. So one of the purposes of NeuroJourney is to help families understand the connection between the problem in their child's brain and the rest of their body. And that's often reinforced here in this text. On the left side, we list the different types of providers that could be helpful to a family for issues in this category. Each of the provider buttons has a little description of what they are. And this area was added after we received feedback that some families don't quite understand why certain providers are assigned to help with a specific domain. For example, why is a speech therapist on my team when we're talking about my child's GI issues? You can also see here as we navigate these triangle buttons, which are audio of the text below. We are trying to the best of our ability to make this complex information as available as possible to people with different learning styles. And so we have added the audio text. As we scroll down further, you can see that this GI domain has a further breakdown. So today we'll choose this constipation tab. And again, you'll recognize the format. So again, a description of what we're talking about and why this is an issue for children with SNI, who are the possible helpers. And then as you scroll down further, you get into the technical information. Here are the things that your child might experience. Oftentimes in this description, there are hyperlinks to other resources or pieces of information. And then you will see, as we shared earlier on the right side, the palliative companion to the technical information. Now from this point, yeah, go ahead.
I was just going to say, so in this instance, in GI, for example, the way these things might all be linked together is, again, as Chrissy said, in the upper paragraph, it would talk about the topics that are going to be addressed in more detail below, but also linking them all back to the brain. In my own personal experience, if you were to take the topic of constipation, I'm not sure if until very late in my son's life did I ever realize how that constipation might be related to his brain not sending the same signal versus the food I was feeding him, or the Marilax that I was or was not giving him. And we are trying to work to create an opportunity for families to see the interconnectedness so that they can understand more globally about what is going on with them. And then in the companion text, it might, for example, acknowledge the difficulties of changing an adult-sized child's diaper out in public and some of the strategies that you might employ, like giving a suppository in order to take your other children to the mall so that you didn't have to worry about that. So it very much acknowledges sort of real life situations that families might encounter.
And I'll also add, we have both mentioned the importance to help families understand that connection to the brain, but it's also for learners to help them understand that too. We've been receiving feedback that the NeuroJourney is a good teaching tool, and so we've started to present this to pediatric residents and have other providers who are interested in using this in their education and training. You can navigate through the GI topics by using these buttons here, going back and forth, or you could click back and get to that main page. I'll move forward just to highlight one more example here in GI. Again, the same format, what you can expect to experience, and so on. And we will, actually, I'll show really briefly to show you how resources are included in NeuroJourney, because our feeding tubes tab has a really good example of that. So in some cases, here you can see information about different types of feeding tubes. We have links at the bottom to external resources. Some of them are from our own CPN website, and in some cases they are resources outside of CPN that we think are exceptional at providing additional information. So you can go back to the main page, or you can just navigate at the top bar and check out the social and emotional map. Again, it's formatted in exactly the same way, with a sense of time from left and right. And these are all of the topics that we cover that families encounter or that they might think about over time related to their experience caring for their child. So for example, you can click on financial planning. And again, in just the same way, we have the description about why we're raising this as an area that you might want to learn more about. Here again are the type of people that might be able to help you with concerns in this domain. And then the technical information follows, and we still have that companion on the right side. Here's an example of a hyperlink to an outside resource. And here are some examples of resources that are within the CPN website and some that are outside of Courageous Parents Network. Let's see. So, Jennifer, do you want to maybe share some of our thoughts about how NeuroJourney may be introduced to families and when?
Yeah, so I think that obviously it's going to be very family or patient specific to your needs and where you're seeing them. But a couple of things I wanted to draw your attention to, which are resources to help you only share specific parts. Chrissy, if you could just click on any medical topic. So you'll see the little share button on the page. This share button allows you to share only this page. And we created this opportunity so that you could use this tool to better meet your families exactly where they are. So for example, if you have a family that you feel might be overwhelmed by seeing the whole tool, you might introduce just the page that is specific to them and bring that page to their attention. They, of course, can move from there to other pages, but you have an opportunity to also meet them where they are. And part of the reason why we phased this was so that families could sort of enter at the place where they saw themselves. And also the ARC gives you an opportunity to talk about where, with your patients and families, where they believe they are on the ARC. So that's one opportunity that you have to share the map independently of sharing the entire map as a whole. I would think, and from my personal experience, I would have appreciated a map like this very early in my son's existence. I was the mom who wanted to know everything and felt more comfortable looking ahead. I know that there are many people that do not feel that way, but I would have definitely dove in head first. As I said, I spent many years frustrated because my GI doctor was not connecting my son's SNI to what he was experiencing in his GI tract. And I think that caused us to do things that we might not necessarily have needed to do. But I know it can be hard to introduce a topic like this to families and ask them to explore it. So what we have also developed in our resource section is a caregiver worksheet that walks families through thinking about NeuroJourney and the things that they've explored, and gives them an opportunity to write down questions so that they can bring it back to the clinicians and honestly the providers, because we hope that NeuroJourney will also be used by the teachers and the aides and respite workers that are helping these families, because the more they know, the better they will be able to serve the child. But it gives some prompts for families to think about, and that is accessible on the homepage.
Yeah, so we have some additional resources here. So if you are already a member of Courageous Parents Network, you can use your same login to log into NeuroJourney. You can see I'm already logged in, it has my name over here. But if you were not logged in, it would give you a login prompt page. If you're not a member of CPN, you can join with that prompt. And here are 4 resources for you. So we have a basic NeuroJourney information sheet that is a printable PDF that describes much of what we said today about NeuroJourney and its development. We include a tool for you specifically as a clinician on how you might go about introducing families to NeuroJourney. So again, some of this information is what we've talked about today, but this is a tool that you can take along with you as you think about introducing it to families or to share with your colleagues as they consider introducing NeuroJourney to families. We also have referral cards, which are long, thin cards on cardstock that you can give as a handout to families for NeuroJourney, and we are happy to send you those free via mail. You can request them here, or you can email us separately to do so. And again, we linked that caregiver worksheet in this clinician area of the website. I also wanted to point out here, just so that you have access to it, this About page says much of what Jennifer described earlier about how NeuroJourney came to be and our suggestions for using it, but it also notes the lead authors and our expert reviewers here as well. Something that I wanted to point out related to introducing NeuroJourney to families, we recently spoke with a nurse practitioner from a complex care clinic who is using NeuroJourney with families already. And she shared the way that she's integrated that in her workflow. And I want to pull that up to share with you because I thought that it was a really wonderful example, bringing this use of NeuroJourney to real life. Just a moment here, bear with me while I share this part of the screen. So what you can see here is how she used her documentation. You can ignore all the things on the left there. In the chart after the visit with the child and family. So she reviews all of the information, the recommendations, and then she included hyperlinks here. You can see where it's underlined to different aspects of NeuroJourney for that family's for that family to refer to later and to go explore on their own. And she did such a nice job of putting the topic right with the recommendations so that they have this companion educational tool right with the recommendation that they're receiving from their provider. Go back to NeuroJourney. And at this point, I want to invite any of you to unmute yourselves and ask questions or share comments or observations if you like to. We have plenty of time for that. Hi, Tessa, go ahead.
Hi. Thanks for this. This is amazing. My colleague Lee and I are just chatting back and forth as you go through this content. And given that we're from Canada, it appears that the majority of the content on here is non-specific to the location where the provider or the family lives. Would you say that there's areas that are less relevant, like depending on where you live, whether it's a specific state or country? Or did you kind of intend for it to be used more widely then?
We always try to make things as widely applicable as we can, although I wonder if the financial planning resources may not be.
That was the one piece that I saw. Yeah.
Right. So I would say medically, the span of SNIs is great, right? There's so many of them, and the complications that these children encounter are very varied. And this was one of the complicating facets of putting together NeuroJourney as we were writing it. So it's even medically, it's not going to be all inclusive of everything that specific child or that specific disorder might encounter, because what we tried to make it was broad enough so that everyone could find the bits and pieces of what were going to happen to them. And more importantly, that they could learn how all of these different systems were connected to the brain. We did, in reading the psychosocial topics, try to keep it as non-geographic specific as possible. But again, in things like financial planning, it was hard for us to provide enough information, and also the expert that we relied on, because we had obviously an independent financial planner help us with this work, is US based. So in that regards, there are going to be a few, but I think for the most part, what you're going to find is it's pretty universally to regardless of where you live. We strayed away from insurance issues and things like that just for that very reason, because the systems vary. Is there anybody else who would like to ask a question or just make a comment? Okay, Ivy.
Hey, everybody. So I'm in our maternal and child health program in Texas. So this is amazing. First, what a powerful, helpful resource. It sounds like, or maybe just for this conversation and this presentation, it's a tool for clinicians to use and to initiate. But if our programs, family-to-family programs, and my program, which is in every state, wanted to post it as a resource for families, it could be for providers too, but the audience is families. Is that advisable? I don't see how you can stop it because it's in the public domain. And I can see how if you're not, if you're just in overwhelm and and you're terrified, looking at the whole arc is just can be too much. So what are your thoughts on ways to share it on the family side when there isn't a clinician, cutting and pasting a particular piece? Because it's out there. And then my other question was, maybe I would imagine you gave consideration to this, and I'm wondering or thinking, like, sometimes I see resources for families and it'll say like helpful questions to think about or helpful questions to bring up to your provider or helpful things to learn from other families and offer some prompts. Knowing that, of course, everyone's experiences so it can be so unique, but there are commonalities. And I'm wondering about that. And then also translation. So for families who, English isn't their primary language, what do you got in the works?
Okay,
so we have an answer for all of your questions.
Yeah, so we'll start with the easiest one, which is translation. So we are currently having the content of NeuroJourney translated into Spanish, and working on French next, and we hope to have Spanish by the end of Q2. And it will be it will be an audio recording to listen to the content on our website. So where you saw those audio clips, you'll be able to choose your language. So we are hoping to bring this in multiple different languages as soon as we possibly can. We have a goal of having French by the end of this year. So that's the easy answer. I would say with regards to prompts and introducing to families, the caregiver worksheet does have some prompts that you could use and families could rely on in order to explore the website. Obviously, this website is for families. You all here are clinicians or people who are serving families, and so our presentation today was how you might introduce this or partner with your families to explore it. We are more than happy to come to any community and do a demo with your community or with your families. We welcome that opportunity so that we're the ones introducing it bit by bit. And yes, it can be overwhelming. I will say this, the average family, and again, this was not my experience, I'm dating myself because the internet barely existed when my son was diagnosed, but most families these days get a diagnosis and they go to Google and they are overwhelmed. And I think the security that you can have in recommending this tool is because of that companion text, which is there to sort of help mitigate the overwhelm because it validates and acknowledges the feelings that families are having as they're thinking about these things. Also, many in the medical map, most of the information requires you to go a level beyond the main topic. So you could say to a family, I only want you to read the main topic page. So just that top paragraph, so that you can start thinking about what might be coming and how it's related to your child's SNI. And then, so you could suggest it in that way and they'll layer into what they are specifically looking for.
I wanted to address this resource sharing, especially via the web. We do anticipate and hope that this is shared as a resource on websites. As Jennifer mentioned, we're presenting to you all mostly as providers or clinicians today, but we do present NeuroJourney to many patient disease groups that are more family oriented. So that is another direct route to families. And we anticipate them sharing this as a resource far beyond our initial presentation. So we do expect NeuroJourney to live out there, and we hope it does, because we hope that families come to it as a resource.
In our beta testing and all the testing that we did, we really did not experience families that came away saying they were overwhelmed by exploring NeuroJourney. In fact, I had a family just reached out to me this week who was introduced probably early in December to NeuroJourney, and they looked at the entire map, even as their child is not very progressed in his particular disorder, and saw it as an opportunity to readjust and this mom regrouped her medical team because she saw it as a way to say, hey, I need to get ahead of this oh, I need to start adding this person so I know I have the right speech pathologist, the one I'm comfortable with. And so they saw it as an opportunity. They got that anticipatory guidance that led them to be the drivers of their child's medical care. So I think, again, it's very specific to the family, and we always try to be sensitive, but that companion voice that comes along really does reassure the families.
And Ivy,
Thank you.
I don't know if you're familiar with Courageous Parents Network generally.
Oh,
I know that
me?
you
Oh,
have never
yes,
met.
very.
Okay, okay.
Like,
So,
yes,
so
yes, yes.
you'll know that,
I know everything you do is like a teaspoon of honey.
thank you. Well, and you know that we know that families can just click out if they become overwhelmed, and they'll do that. We also survey our family members for CPN. We don't have that yet for NeuroJourney, of course, every 2 years. And what we have learned from them is they say that once they get into CPN's regular website, they do just go poke around. And so I anticipate the same thing will happen for NeuroJourney, that they'll want
Well,
to do that.
thank you. I really appreciate it. It was when you said, maybe just give bites, you know, how do you really do that if it's posted and it's out there? And so I really appreciate the reassurance. I'll certainly do what I can to have it added to our Texas family resources. And your point about in this day and age, it's so true. I have a daughter with a rare genetic syndrome, and she'll be 30. There was no internet resources. So of course today, you hear one thing, cut your finger and you're on Google. So that is
Yeah.
true. Good, I got it. And I appreciate the reassurance to not hesitate. Families will figure it out.
Yeah, and Ivy, I also want to say, if you're struggling with what language to share or you use as you're sharing it out, we're more than happy to work with you to develop that language. And I would encourage you to, again, go back to this concept that's on the homepage of the Arc of a Life, because I think that also is very embracing that every child, regardless of their circumstance, can have a full and complete arc, and that this tool is here to enable that to happen. So that what we're really talking about is the quality of life and how rich and loved and good it can be. And that's why it's here on the homepage. And that, I think, is a good way to introduce this, that it is the way that you can help ensure a full and complete arc for your child.
So beautiful. And what our families never hear when the diagnosis is delivered.
Mm-hmm.
Mm-hmm.
Or virtually never. So it's a great message.
And related to Googling, while NeuroJourney is not in a app format, it does show up really nicely on the phones. We had explored what it looked like and what the experience was like for users on different devices. So I'm pleased that it comes up in a nice way for families when they pull it up on their phones as well. Other questions or observations?
Josh, I had a question. So thank you. This looks like the effort of a huge team. So I can only imagine the behind the scenes effort, but either way, it's a really exciting tool. And thank you for all of your work on behalf of the community. So I'm a provider and researcher of really caregiver networks up in Rochester, and wondering, we are kind of slowly but surely building a support program for sort of caregivers of infants with neurologic impairment or medical complexity. And so I guess I'm wondering, it looks like the first sort of phase is adapting to a diagnosis. I do find sometimes with our peer networks that sometimes there is no diagnosis at the beginning. And I guess I'm just wondering, when from your focus groups or engagements have you thought about, like, I know there's not necessarily a right time, but like, how early in the adaptation process do you all think this tool sort of is most optimally introduced to families? Like how early?
Mm. I think that that's a complicated question, again, only because it depends on the family itself and also the child's diagnosis. So, well, my son, Ben, who had Sanfilippo syndrome, spent, the first 10 days of his life in the NICU. It probably wouldn't have been an appropriate time to introduce NeuroJourney to him, since he seemed not very neurologically impaired at the moment. So that would not have been an optimal time to introduce it to me. However, we have another family whose child did have an SNI, and a severe one. He actually passed away under the age of 1. And I think the family might have benefited from being introduced to this tool earlier, because truthfully, there wasn't anyone really explaining to the family why all of these independent problems that were happening and occurring in their child were actually related to the brain. So again, it's sort of circumstance specific, because if you're the clinician there and you're having conversations with the family that's explaining this to them, then they probably will welcome this tool so they can understand some more. And you'll be able to walk through it with them to say, this is probably something that may not happen with your child. So it's hard for me to answer that specific question. I mean, of course, you don't want to overwhelm a family, and you have to look at what's the longevity of this experience for them.
The longevity of your relationship with that family as well. And that the family who lost their son under the age of 1 that Jennifer is referring to, we have videos of them actually on CPN because they were interviewed. And one of the things that always stands out to me is his mom says that when they delivered the diagnosis, because it was so extremely rare, the comment was, we don't know much about this. And that was so hard for her to hear. And I think that for this particular family, under those circumstances, it may have been helpful for them to hear, we know very little about this particular diagnosis, but we do know that it's associated with this thing called SNI, and we can tell you what that is like for your family. And I think they would have preferred being told what they could know, as opposed to feeling like there was a void.
Yeah, no, this is great. Yeah, I'm a hospitalist, so I see a lot of these families when they come to the hospital with their first cold, and I find that often is for some families kind of the first time in which the healthcare team is attempting to explain, well, the reason that your child is hospitalized because of the cold is because of their connections between their brain and their breathing. So I'm excited about that specific aspect of the tool too. So thank you.
And of course, I also want to say this, as all of you are exploring this tool, this is not a static being. This is a living thing, and we always welcome feedback from you as you're exploring it. So please, please, please reach out and let us know your experiences with it.
I was thinking about that, Tessa, when you raised the differences in Canada, because when we do have the French translation, maybe we ought to then think about some financial resources in Canada to put on that page, because we're obviously going to be hoping and expecting that the French translation will invite more families from Canada to use it. So it is definitely a dynamic resource. We are happy, as Jennifer mentioned, to come present to your teams or your other colleagues, wherever you are. So please let us know. You can do that anytime virtually. We've been kind of chipping away hospital by hospital right now doing that in a variety of formats. Sometimes we're given 15 minutes at a departmental meeting, or we have a full lunch and learn hour, or grand rounds where we've been presented with the range, just depending on that institution's availability. So we would love to do that. And you should email us anytime.
Yeah, and we will send a follow-up email out to you with some more resources that will help you specifically with regards to NeuroJourney. And then, of course, Courageous Parents Network, our original platform, we're also welcome, you're also welcome to contact us about how to better utilize that in your practice as well. And for those of you who may not already know, we do have a whole separate portal for clinicians with many of the same tools that we're trying to develop for NeuroJourney, that it help you either do some self-education, refer to families.
It's a good place to send your learners as they come rotate through. They
Yep.
have a lot of basics covered in here.